A chronic total occlusion, or CTO, happens when a coronary artery, which supplies blood to your heart, becomes almost completely blocked with plaque. Many times it requires a bypass surgery to fix. But in today's Your Healthy Family, NCH Healthcare System was the first in Naples to offer a different, less invasive option. During a bypass surgery to clear a chronic total occlusion, doctors essentially create a new pathway for blood to flow around a blocked artery.
Unfortunately, not in all cases do people get treated with surgery. Sometimes they are deemed to be at prohibitive risk for surgery, and if they don't meet criteria for surgery, they may be left really just to handle their symptoms medically, and it affects your quality of life.
Interventional cardiologist Dr. Adam Frank says, then NCH Healthcare System became the first in Naples to offer another treatment option, percutaneous coronary intervention.
Allow us to open up these arteries that have been chronically closed and provide better blood flow to the heart muscle, alleviate symptoms, and make people feel better overall.
So, how does it work? Well, through a catheter in the wrist or groin, Dr. Frank says they go into the artery where that chronic total occlusion or blockage is, and using their tools,
you have 100% blockage. So you have to dig a little bit, you may have to break open that plaque, that cap a little bit, or the more sophisticated technique is where you actually dissect around the blockage, and then you create a whole new channel, which is really amazing. There are specialized balloons, there's a laser, there are special techniques which allow us to actually intentionally dissect and go around the blockage. So we put a wire through the vessel, we expand a balloon to kind of push that plaque aside to restore flow.
And Dr. Frank calls it a game changer.
I've been here close to 15 years. I've seen many patients with chronic occlusions that unfortunately were either referred for surgery, either couldn't get surgery, and we really haven't had the level of expertise that we now have to offer them a treatment.
He says they treated their first patient with this procedure in June.
It was an 80-year-old gentleman, a retired physician who loved to play tennis, and his symptoms were just on the tennis court. He found himself becoming more and more fatigued. We spent about 2 hours getting the vessel open. It came out great, and literally next week he's back on the tennis court, and he said his symptoms are gone.
And since then, doctors at NCH who do this procedure have only gotten more efficient. Dr. Frank says patients who do have this done usually go home the next day with just a Band-Aid covering their incision. For Your Healthy Family, I'm Lisa Greenberg, and for more health stories, head to fox4now.com/yourhealthyfamily.